I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today's topic is pain control during laser and electrolysis hair removal. I think this is trailblazing stuff, and the reason I say that is for many years there have been very few options for pain control during these potentially very painful procedures. So let's get started. Trans people have been requesting hair removal forever. Of course, there's face and body hair removal for day-to-day presentation consistent with one's gender identity, but more recently we're seeing many requests for hair removal before gender-affirming surgery. In fact, it's generally a requirement. So if you're in that situation, be certain that you ask your surgeon what type of hair removal is required and if it's required at all. So patients have been long requesting pain medication to help them get through their hair removal procedures. And in the past, I have prescribed narcotics, anxiety medications, and sometimes prescription strength lidocaine cream when that was necessary for people. But one day, when I was writing prescriptions for Emla cream and Vicodin, I thought, boy, if we did these hair removal procedures in our office, we could provide much better pain relief in a safer way, more monitored way, and probably more effectively for our patients. We could give people pain medication in-house with appropriate monitoring to keep them safe, and patients could get their anesthesia immediately before treatments rather than having to travel across town to do that. So we bought a hair removal laser, and I learned how to do electrolysis. Now here you can see I'm doing electrolysis on a willing victim while I'm learning. My malpractice company actually required that I learn how to do both laser and electrolysis hair removal, and I am terrible at doing electrolysis hair removal. I have staff that I work with who can do it much faster and much better than I ever could do it. So make certain that you see a qualified professional for these services. Okay, so here's what we learned in our practice when we started doing these procedures. First of all, people vary a lot in their experience of pain. Most people say that hair removal is painful. I had some electrolysis hair removal when I was in college, the upper lip area, and oh my goodness, I thought it was terribly painful. So it depends on the person. It depends on the length of the treatment. We limit our treatments to about 90 minutes per treatment, but some places do treatments for a full day. And fortunately, they do use injectable anesthesia as they go through those daily treatments. It also depends on the part of the body that's being treated. So we know, for example, that areas around the lips, under the nose, for example, any place, for example, that's over a bony prominence, like the angle of a jaw, for example, can be more painful. And certainly the genital area has been a painful area as well, according to our observation in our clinic. So what's available over the counter? Well, you can do pre-medicating with ibuprofen or acetaminophen. These are reasonable things to do. So those are Motrin, for example, or our Tylenol. And these are widely available. We use ice packs before, during, and after treatments for pain control. If you look online, you can find lidocaine cream or spray. It's less strong than what we use, but it's available. And if you're trying to find it, I would look up like lidocaine cream for tattoo removal, for example. So on this slide, I've given you an example of a tattoo removal product, not to endorse it particularly, but just to let you know that these products are available. Now, remember that there are risks with all medications. Everything has risks and side effects, whether it's over the counter or prescription. A person can have an allergy to just about anything that's out there. Lidocaine also can have toxicity associated with it, not allergic reaction, but an actual toxic effect from the medication in higher doses. And toxicities to lidocaine can include things like seizures and heart arrhythmias. So these are very important things to be aware of. You can get into a toxic range if you use repeated layers of lidocaine, for example, or Marcaine. So it's important to know that. Remember also that people that come to the clinic may arrive having used other medications before. So it's important important to keep that in mind. In our office are anesthetics that we can use that are prescription strength. For example, we use a pre-treatment of BLT cream. Now, BLT consists of benzocaine, lidocaine, and tetracaine. Each of those is an anesthetic in and of itself.